everyone, and welcome to the Trinbago RN channel. This is Miss Nell, and today we're going to be discussing medication frequency abbreviations. If you enjoy the content, please like and subscribe. So let's begin. It is important to be familiar with terminology regarding frequency to ensure proper medication administration. Frequency can be defined as the rate at which something occurs or the period in time over which a task should be completed. In medicine, frequency refers to how often medication should be administered. So, when we hear that, we should be thinking to ourselves, is it every 2 hours? Is it every hour? Is it 3 times a day? Is it an AM dose or a PM dose? Will it be a BD? Will it be OD, meaning once a day or twice a day? So as we continue, we will go over, or we will discuss, some common medical frequency terms. Some abbreviations that we will see are Q, which may be common or capital, and that represents every. So we must see Q2H, which will mean every 2 hours, H or HR, which will represent hour, min or mins, which will represent minute or minutes. So the doctor's order may show administer Panadol Q4H, which will mean every 4 hours, or check vital signs Q15 minutes, meaning to do so every 15 minutes. So as a nurse, it's important to be familiar with the jargon in order to understand what tasks need to be completed. Other abbreviations include TDS, which would mean Q8H or every 8 hours, QDS, which is every 6 hours, and QID, which is every 4 hours. If at any time you are unsure as to what the order means, then it's important that you consult your doctors for clarification or senior nurses on your unit. This allows you to ensure that the patient receives their medication at the correct frequency. Some other frequencies that may be ordered may be based on time of day. For example, morning, which means morning, indicating that the order will be for the medication to be given in the morning period and not in the evening or night. Another term would be nocte, which means medication is to be given at night time and not during the day period. So for example, the doctor's order may be to administer simvastatin 40 milligrams PO nocte, which should then indicate to the nurse that the drug will be given at night. This brings us to our other frequencies, which is OD, which would mean once daily, so the medication would only be administered once. BD or BID, which would mean twice daily or every 12 hours. So it may be written in any one of these fashions. So it's important to be familiar with both methods. Some other miscellaneous terms include STAT, which means immediately, or time critical. So whatever it is that is ordered by the doctor, for example, the doctor may order Ventolin STAT for a patient that is having an acute asthmatic attack, and that medication has to be given immediately in order to hopefully effectively relieve the patient's symptoms, or at least prevent it from worsening. Another such term is PRN, which means pro rata, which means as necessary or as needed. In this case, the patient will not be given medication routinely, but rather will be given medication if the need arises. For example, the doctor may order Panadol PRN if temperature spikes. So Panadol will only be administered if the patient shows signs of having high temperature. X, which represents time or times. So you may see the doctor order saying, for example, Ventolin times 1, which means one time or one dose only. So only one dose of that medication, in this case Ventolin, would be administered. Times 2 would mean 2 times or 2 doses only of the drug ordered would be administered. And this can continue as needed. Times 3, times 4, it will be based on your patient's situation. And this brings us to the end of our short video on medication frequency abbreviations. Thank you for watching. Please remember to like and subscribe if you enjoyed this content, and feel free to comment other things that you may be interested in seeing on this channel.